Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President, and currently the President and CEO of the National Black Leadership Commission on AIDS, Inc. The mission of the National Black Leadership Commission on AIDS, also known as NBLCA, is to educate, mobilize, and empower Black leaders to meet the challenge of fighting HIV/AIDS and other health disparities in their local communities. Today, we will be addressing efforts to reach African immigrant communities in New York City with HIV and AIDS education and services. It is well known that sub-Saharan Africa has been hardest hit by HIV and AIDS worldwide. But what is less talked about is what is being done to address the health of Africans right here in New York City. So here today to discuss this is Bakary Tandia, a caseworker and policy advocate for African Services Committee. Based in Harlem, the African Services Committee, known as ASC, is dedicated to assisting immigrants, refugees, and asylum seekers from across the African diaspora. Bakary assists clients newly diagnosed with HIV in assessing health care, housing, and supportive services. He also works to raise awareness of public health and human rights issues in the African community. So welcome, Bakary, today. It's a pleasure to have you, and I thank you so much for joining me for this discussion. And I've seen you in different places around the city, and we both know many of the same people.
Yes.
So having you here today is exciting. So why don't we begin with you telling us just a little bit about ASC, African Services Committee's work in terms of what the mission is and a little about what you do there.
Thank you very, very much. My name is Bakary Tandia. I am very honored to be here sitting next to you because you are very, very important in our community. We thank you for leadership when you were president of the Borough of Manhattan. And still, through your leadership, you are doing a lot for our communities, and that's why we are here today talking about this very important issue, which is public health in general, and particularly within African immigrant here in the U.S., precisely in New York. I am glad that you asked this question about African Services Committee, which is the main African immigrant organization here, I would say, in the United States. And the mission of the organization is to address the needs of African immigrants, particularly in the area of health. As you know, as a human rights activist, I would place the work of African services in the context of human rights, because health is the most fundamental human rights. If you are not healthy, if you are in your dying bed, you will not be able to go and exercise your writing votes on November 8th. So health is very important. So what we do, we offer a range of services. Number one, we educate our community members and even beyond about HIV/AIDS crisis. The most important, the first step is how to educate people in terms of prevention. So when someone is infected, how to assist that person. Because most of our clients, for instance, who are undocumented, they don't have access to medical insurance. And also we have a growing number of African immigrants coming from French-speaking countries. That was my own case when I came here in 1992. I didn't speak English.
1992, you spoke no English?
No English.
And look at you now.
I have to struggle to learn how to speak English. So I can relate to those individuals. I know what their struggle is about because it is my own struggle, my own experience. So we educate them. If they don't speak English, we speak French, we speak African languages. Myself, I speak Fulani, I speak Soninke. Those are key languages in West Africa. Fulani is spoken in more than 15 countries in maybe 20 countries in Africa. Soninke is spoken in more than five countries. We have Wolof, which is spoken in Senegal and in my country, Mauritania, and Gambia. So those, it's really, that is the language and cultural capacity constitute the strength of African services. So we help people to have access to the services they need. We also offer emotional services. As you know, one of the main challenges with HIV/AIDS around the world, it's not just true for Africans, it is true here. The main challenge is stigma. The stigma associated of being HIV positive. How to offer the support they need. And I would go even further. Sometimes self-stigmatization is even worse than stigmatization. Because when your mind, your imagination can even go further than what people might think about you. That can be a trauma.
And that, I think, is a very important point you make, because we clearly see that as among the many barriers that we face right here among African Americans, the populations that my organization, NBLCA, works more directly with. You said a couple of things. You talked about health as being a human rights, that health should be seen within the context of human rights. And I think you're absolutely correct, because if one does not have good health, they cannot in any way fulfill all of the other responsibilities or expectations that we have. And you also did a very good thing. You corrected me on your name, Bakary. I think that is so important, because I said something very different. And I think, it is important that we know and correctly speak names of individuals, especially people who are not from this country. So it's Bakary.
But what I would like to add, people know me by Bakary Tandia, but by Tandia. If you want to find me in New York, you go by Tandia.
So what's in a name?
That is my last name. There is a political reason for that. And I can even give a conference on why.
At another time, we will do that.
Yes.
Okay. Well, tell us a little bit about where are you seeing geographically in New York City sort of the greatest need for the services you talked about, certainly the education and testing, and how receptive is the population with which you're working to testing? Yeah,
this is very important. We, in terms of strategy, African Services is very, very strategic. Since we understand our population, we have a holistic approach, because you cannot just ask people to come for testing or linkage of a linkage to care if you don't have a good understanding of the other issues. Well, for instance, we know that most of our people are in need for immigration services. legal assistance. But for instance, someone can be harassed in his or her own apartment because the person doesn't understand fully its rights. We have a legal department for that. If you are linked to care and you are living in the street, you will not be able to fully adhere to your treatment. But so that's why we have housing component for that. Access to treatment is not just swallowing pills. It's also understanding what you eat, what you put into your body. We have nutrition services educating people. Even though you don't have HIV/AIDS, you need to eat. You need to understand, to know what you eat. That is the best way in terms of prevention.
So how much plays into, you talk about immigration status. So being undocumented, the fear of perhaps even getting tested or treatment if one is positive, and making certain that the resources, or because resources are available, getting access to that. So how is that worked out because of that fear of status in terms of immigration status?
Yeah, it is. It is. That's why the work of African services is very, very important. But that's why the uniqueness of African services makes it a very special, organization. Because you have people who are undocumented. They have, HIV infection, and also morally, there are expectations to support their family back home. Sometimes when I see people in this situation, I try to picture what is going on in their minds, because you are here to succeed. You are here to make a life, not only in your own life, but in the lives of the entire community, the entire village, the entire city. Here you are.
Everybody's looking to you to help them improve their conditions. You are fighting for your health. We understand that. But that's why, number one, we try to make them understand that we have a family-centered approach. When people come to see me or anyone in our organization, if I am older than someone, the person will call me grand frère, big brother, my cousin. So it is not traditional service delivery system. So people feel connected, and they find in African services a home and a family. And you meet them where they are.
Yeah. And we speak the language. We explain what their rights are, what are the resources that are available to them, and also we are very flexible. They know they can reach us anytime. It's not like 9 to 5. That's why I always say this type of job, it is not a job. If you see it a job, you will fail.
Yes.
You have to look at it as a mission.
Now, what about the population? Approximately, and we'll go back to sort of like the geographical areas, because I think sometimes people think about Africans just being in one community or one location. So in addition to sort of the geographical areas where you think you're doing most of your work, what is the size of the population that you might serve on an annual basis? Say how many people you might see coming through the doors of ASC?
Yeah, annually Annually, we serve about 12 to 15,000 people a year.
Wow, that's very sizable.
And also, what is really interesting about African services, I was talking about holistic approach and being strategic in terms of service delivery, is, you know, we provide a range of services like ESL, like linking people to care, even though they are not HIV positive. So coming to African services doesn't mean necessarily that the person is infected with the virus. So people feel more comfortable, you know, to come. People can come for...
How is that message, you know, transferred or transmitted out there? Because the name African Services Committee, and as you're saying, you provide services beyond and other than just HIV.
Exactly.
So that is communicated, and that brings more people into the...
Yeah, people feel more comfortable, you know, because as I said at the very beginning, stigma is a very, very big problem in all communities. Even when I attended, you know, conferences at the UN, and you know, sometimes resources are available,
and many times they're not.
You know,
so I'd just like for you to help me kind of focus on the HIV services. Can you think about what percentage or numbers perhaps of those 12,000 annually being serviced by ASC who actually are persons living with HIV? Just trying to get a feel for the size of that population. Or
the percentage of people living with HIV is among the size of population we serve. Since I did not look into the breakdown, it will be very difficult to be more precise. But I would say at least it could be around 50% of that.
That's very sizable. I'm glad to hear about the broad range of services that are provided through the organization. But I was just curious about what percentage of that might represent persons who are living with AIDS. And are you seeing this across all 5 boroughs of New York City?
Yes, we are a citywide organization, and also currently we have many non-Africans coming to us. We have a sizable number of Spanish. We have Asian. We are open to anyone. As you know, when you are successful, everybody comes.
Now that's real. That is so real. Because I was thinking the same thing as I listened to the range of services that you provide and the holistic approach that you take to your work. The more people who hear about the services and the needs that exist, they're going to come.
We have an
open up the doors or make it known your services. And
we have an overwhelming number of non-Africans coming for different services because our programs are working very, very well. They are effective. They are flexible.
And that's across the city.
Across the city.
Do you have, where are your locations? I mean, your main office is where?
On 127.
That's
between
the headquarters, right.
127 between Convent and Amsterdam Avenue. It is also very accessible. People from Brooklyn can easily come. You have two express trains, A and D, and then you have C, you have B, and even someone who is athletic from Lenox, you can just walk straight from number 2, number 3 to our office. People coming from Queens, from Bronx, from everywhere. It's really very, very easily accessible.
So since we're on that, why don't you just give our viewers the exact address and even your website number in case someone would like to follow up and contact you.
The exact address is 429 West 2nd floor, New York, 10027.
And that's West 127th Street.
127th Street, between
Amsterdam
and Convent.
And Convent.
And any train to 125 West Side
will bring you right into that zone.
Exactly.
Okay. One of the things I like to cover, of course, maybe before we conclude, and that is, I'm very big on policies and budgets because I fully understand that the policies can help drive budgets that are needed for the work that we all do. And in far too many instances, we're seeing a dwindling of funds, especially in the area of prevention. We're seeing many more funds move over to treatment and care, and we recognize we must take care of people who are in need as it relates to treatment and care. But prevention is still so important. So what can you help us in terms of knowing more about what you see as some of the policies that might be needed in order to address the work that you're doing with respect to HIV as well as other services that you've certainly articulated that are being provided by ASC?
Yeah, it is a very important question. That's why we also, even though we don't have a strong policy department, it is very, very important while providing direct services to meet the needs of community members, to also engage in policy and advocacy, to articulate our issues. That is very, very, very important. The areas we really need more support, I would say, all the programs are really, really needed. We have a very active, legal department. As you know, legal issues are multidimensional. Every single aspect of our lives here is regulated by law. So whether it is immigration, it is housing, you name it, every single aspect, and it is expensive. And beside that, housing. There is a serious housing crisis here.
Yes.
So we really need more funding, more support in that area.
What are your basic sources of funding? Government or contributions?
Individual foundations.
Foundations.
Federal, state, city, and our co-executive director is very, very active in terms of proposal and networking, and we need, and also we need our own home, because the place we are occupying currently is rented,
Yeah, and I think that's part of what we hear a lot too from nonprofit organizations, including my own, in terms of the costs for rental of spaces. Perhaps what we need to do is get together as nonprofit organizations and together buy a building.
Yeah, to have a complex.
A complex.
This is an excellent idea.
And we all can afford to keep it going. Except that in today's market in New York City, that becomes a little expensive too, though. But I think the policy issues as it relates, again, to housing, and at least here in New York City, with a lot of attention being given to affordable housing, hopefully we'll address that. But I think the other issues around mental health, I think you mentioned about emotional health,
exactly.
which of course is mental health support.
Funding for mental health is very important, and ESL classes, because we have so many people coming from French-speaking countries. And currently, what I have seen at African Services, what is really encouraging and interesting, we have so many women attending the ESL classes. As you know, for cultural and political, reason, on the continent, women did not have the same opportunities to go to school as men. And right now, the population of women is increasing. And you can see the burning desire to learn, you know. And they are attending. It's very encouraging to see, even though they have to struggle to find babysitter, to find a way to come, because they know that without education, without understanding the language, without being able to read their own mail, it's not life.
Well, I think that, Bakary, you've certainly raised a lot of issues here as it relates to need addressing the health of Africans here in New York City, because all of this directly affects one's health. If one is under stress because of the status of the immigration status, or not being able to take care of the children, not being able to speak the language to get the job. And I'm not sure that we focus a lot on that, especially with respect to the African immigrant population. So I hope that today's show will open these discussions up much broader. We never have enough time, but I do want to thank you for being here, because you've certainly put a lot out, and we invite you back to learn more about African services, and we thank you for joining us today.
As a policy advocate, human rights activist, this is really, you know, the opportunities we look for.
Great.
Yeah.
Okay, so you've heard a lot, and to learn more about the work of African Services Committee, we invite you to go to africanservices.org, and to learn more about National Black Leadership Commission on AIDS, check out our website, NBLCA.org. You may look for us on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. So please let your friends, family, and neighbors know about this programming. I am C. Virginia Fields, and thank you for joining us, and hope you'll tune in next time for NBLCA's Health Action TV right here on Manhattan Neighborhood Network.